Hello everybody and welcome to a new video. Now, it's almost December, so I have to get some of these videos done that actually require Adobe Flash Player or whatever. So, if any of these are a repeat of these surgeries that I'm going to do this recording session, I apologize. Michael, I think, will edit it properly, so there might not be any repeats. He's going to take the best footage from these. I have, as of recording this, I have like roughly 3 days until December, when they actually cancel that. So I have to do all of the Whack-It games, because I promise I'll do all of them so that it doesn't make me look like a bad guy. It's going to be fun. So, and I have lots of time to do it because everyone's busy. Michael was busy editing, streaming his stuff, and recording his stuff. And Austin's with his family, and then when it gets closer to Christmas, Michael's gonna be with his family. So I have lots of time. Anyway, so we're just gonna go in order and do them all. Michael's gonna take the best clips from whichever surgeries that he already has, and then this, like, however long it's going to take, I have to get these done because I wanted to do them. And so right in this part, or this, we're going to do and it's going to be broken down into different the different categories on the screen right now: oncology, cosmic, eye, gastric, OB, and geno, nails, oral, and orthopedic. So, if you guys are, and there's going to be a warning in front of every single video, on every single video, if you guys, because some of this is kind of sensitive, I get it. I just did a couple of them already and I want to get them all done. So, we're just going to plow through these as best as we can. Let's get started. So, first we're going to do oncology/cancer. Double mastectomy. Excuse? Is it already gone? No. Allow it to run. There we go. Let's hope it actually goes through my headphones.
Welcome to Surgery Squad's virtual double mastectomy. I'm Dr. Susie, and I'll be helping you with this procedure today. A double mastectomy is a surgical procedure that is used to remove both of the breasts as a treatment for breast cancer. If you're not familiar with breast cancer, it's a disease that originates in the inner lining of the breast's milk ducts. With the exception of skin cancer, breast cancer is the most commonly diagnosed cancer among women in the United States. Scientists and researchers aren't completely sure what causes breast cancer, but they do know that there are certain risk factors that put people at a higher threat of developing the disease than others. These risk factors include age, genetics, personal health history, and diet. Fortunately, there are a number of treatment options available for those diagnosed with breast cancer. These options include surgery, chemotherapy, radiation, hormonal treatments, and holistic medicine. Our patient today was diagnosed with cancerous tumors in both of her breasts. Having tumors in both breasts is rare, but when it does happen, doctors stage each breast independently. According to the patient's records, she has stage 1 breast cancer in her right breast and stage 2 breast cancer in the left. After discussing her family history and health habits, our patient and her doctor have determined that a double mastectomy is the best option for treatment. To begin, we need to get an intravenous line started. This will provide our patient with necessary fluids and medication throughout the surgery. A tourniquet has already been tied around her upper arm. Can you find a suitable vein in the patient's hand? That should work. Sterilize the injection area using a sterile alcohol wipe.
Alright.
Insert the needle and advance the angiocatheter into the vein. The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. Now I'll release the tourniquet. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed. Now that the needle has been removed, I'll dispose of it in a sharps container. Lastly, we need to secure the IV with tape and test the line. For those with a weak stomach or have children in the room, I need to let you know that the next few steps get a bit graphic and contain nudity.
Alright. Why do I keep hearing the beeping? Okay, whatever. Anyway, so if you ever had what was it called? Where they put one of those in your arm, it's not just it's for other things too. Just in case they need to put something in your... The tape does not always work as well. I had that in the hospital back when I was like, was it 18? I don't know, whatever age I was when I was back then. And there's a video up on the channel, but I sleep all over, like, so that tape and then the thing ended up ripping out. There was blood all over the bed. It was beautiful, but I only recorded a little bit. Anyway. So, anyway,
This procedure may not be appropriate for work or school environments. Click the continue button when ready. Next, we'll use a chemical antiseptic known as chlorhexidine to cleanse the patient's skin. Use the applicator to apply the chlorhexidine to the surgical site.
Okay.
We're off to a great start. Today, we'll be giving our patient a general anesthetic using a face mask. Once the patient begins breathing in the anesthetic gas, her bloodstream will carry the gas to her brain, preventing her body's nerves from communicating with it. This will allow her to be completely asleep and free of pain during the surgery. Place the mask over the patient's nose and mouth. Once it's in position, I'll turn on the anesthetic gas. Now that our patient is unconscious, we'll insert an endotracheal tube into her mouth and down into the windpipe. This will help her breathe and provide a constant mixture of oxygen and anesthetic gases during surgery. Use the pen to sketch where we'll be making our incisions.
Make me be steady on the mouse, eh? Thanks. Oh my goodness, I'm terrible at mouse movements. This is why when I play Minecraft,
Grab your scalpel and make the incisions in the patient's right breast. This will give us access to remove the tumor and breast tissue.
Right. I'm not a big...
Remove the tumor and breast tissue using forceps. The electrocautery device will separate the tumor and tissue from the chest.
Oops.
Great. I'll send this to our pathology lab for examination.
I didn't know that they actually removed the whole frickin'...
In the meantime, we need to insert what is known as a Jackson-Pratt drain. This will prevent excess fluid from building up on... When you're finished, suture the wound.
I didn't know that they actually took out the... That sucks if you're not... If you want to have children, that must really suck. You need to have a lot of formula instead, and then your kids won't develop as well. Will the other one be done for us, or do we have to do the other one ourselves?
That was flawless. Now let's do the same thing to the left breast.
Oh my god. Yeah, let's make this
Right
longer.
on. That's coming along nicely.
Why did I do this in the early morning?
Keep it up.
Can we go faster? I have like 300 more of these to... I have other things to do still. Why can't you do this for...
Couldn't have done it better myself. After a double mastectomy, most patients will need to stay in the hospital from 1 to 7 days, depending on the complexity of the surgery, complications, and if any breast reconstruction is performed.
Right.
While in the hospital, patients are taught various exercises that will help avoid arm and shoulder stiffness. These same exercises may also prevent the development of significant scar tissue. It is highly likely that physical therapy will be required as part of patients' recovery. Patients are also provided detailed guidelines before leaving the hospital. They may include proper care of the surgical wound, post-surgical care while at home, and the treatment of future scarring. Remember, a double mastectomy is a major surgical procedure, and recovering from one may be emotionally tough. Advice that physicians may offer patients to help them recover emotionally may include finding someone that's had a double mastectomy for emotional support. You may find that this person is more helpful than any book or video. Be optimistic. Researchers have found that optimism can not only improve the speed of recovery, but it could improve everyday health as well. Give therapy a chance. This includes participating in individual and group sessions to discuss your experience, challenges, and successes. Do what you love. Don't let a double mastectomy keep you from doing the things you enjoy doing before the surgery.
Can I have a baseball bat?
And that's a double mastectomy. If you found the surgery educational, share it with a friend. And if you're up to it, check out another procedure on surgerysquad.com.
Thanks. Alright, well, that means I don't need to do... Okay, that loosens it up a little bit, so I only have technically 3. Let's go into this one. Oh my gosh. Hello. Okay.
Welcome to Surgery Squad's Breast Cancer Awareness course. I'm Dr. Susie, and I'll be providing you with vital and potentially life-saving information about breast cancer.
A shorter one.
For those with a weak stomach or have children in the room, I need to let you know that this information is a bit graphic and contains nudity.
It's all graphic.
It may not be appropriate for work or school environments. Click the continue button when ready.
Thank you. Thank you.
To better understand breast cancer, we'll first review the basics of cancer itself. The word cancer refers to a group of diseases that are the product of mutations in genes, specifically the genes that are responsible for regulating the growth of cells in the body. When the growth of cells becomes uncontrolled, a cancerous mass, or tumor, develops within the body, intruding and destroying adjacent tissues. While it is nearly impossible to confirm what caused a specific cancer in a person, scientists and researchers have been able to categorize the potential causes of cancer into 2 groups: environmental factors and hereditary genetic defects. Environmental factors make up approximately 90 to 95% of all cancer cases. These are things such as alcohol and tobacco use, obesity, poor dieting and exercise habits, and pollutants. Hereditary genetic defects make up a small percentage of cancers, between 5 and 10%, and include BRCA gene mutations, which greatly increases the lifetime risk for breast cancer in women and men.
Well, 1 in 8 versus 1 in 1,000, I guess. Ugh. Anyway. So, I don't know if they're going to actually tell you how to search.
Breast cancer typically begins in the milk-producing glands of the breasts,
You said
and
male
if
or
left
female?
untreated, the cancer can make its way into underarm lymph nodes. These lymph nodes provide the cancer with a pathway to other parts of the body. This is referred to as metastasis. While breast cancer may be a frightening topic to think about for most, it can be overcome. If you or someone you know has been diagnosed with breast cancer, keep in mind that there are more than 2.5 million breast cancer survivors in the United States, and scientists are working around the clock to develop new treatments and to find a cure. Before we move on, take a few minutes to review the various stages of breast cancer using the arrows below.
I know it's more rare for men, but can you do a math? Thanks. I'm not reading them. Or should I read them? No. I have a lot to do today, so. Stage 11A, whatever that means. 11B. What? Okay, they're Roman numerals then, I guess. Sure.
There are a variety of breast cancer treatment options available. The treatment for each patient varies depending on their breast cancer stage, overall health, and willingness to try the treatment.
Are you going to show how...
Click on each treatment option to learn more.
You're going straight into different treatment. Anyway, so if you're male or female and you like touching these beautiful things, then just basically just feel around. Or if you're a baseball player, just, I don't know. When you do like this, because you're stressed or whatever, make sure you like feel around for bumps, basically. I guess, whatever. That's legitimately all you have to do, so.
If surgery is the preferred method of treatment,
Right.
a surgeon will typically go with one of 3 procedures to physically remove a tumor.
Done all this.
These include a lumpectomy, where a small portion of the breast is removed in addition
Which
to
we're
the
gonna
tumor.
be doing.
A quadranectomy, in which a quarter of the breast tissue is also removed.
Which we did.
And a mastectomy, in which most, if not all, of the breast is removed. Some of the underarm lymph nodes may also be removed if it is discovered that the cancer has spread. After a mastectomy, many patients elect to have a breast reconstruction surgery immediately afterward.
Breast implants.
During this procedure, the surgeon works to preserve the appearance of the breast using prosthetic material or tissue from other areas of the body.
Yeah, but it's not gonna work the same way. Radiation therapy.
Radiation therapy is generally used to enhance the effectiveness of a lumpectomy, but is also used in combination with some mastectomies. It involves using a high-powered X-ray to destroy cancer cells that remain within the body after surgery.
Otherwise known as chemotherapy.
Systemic therapy is the use of medications to treat cancer cells and can be used in combination with each other to boost the overall effectiveness of the treatment. Chemotherapy, hormonal therapy, and immunotherapy are all types of systemic treatments.
I'll be right back. I don't really need to say that, but Michael, you might want to lock your door when you edit.
Holistic therapy is less of a treatment option and is primarily used as a method of reducing stress, improving mood, and enhancing a patient's quality of life while they go through conventional therapy. Examples of
Otherwise known as like yoga and acupuncture. Sure.
holistic therapy include acupuncture, aromatherapy, yoga, and guided imagery.
Okay.
It is recommended that patients discuss holistic therapy with their physician before attempting it.
Alright, we did.
When it comes to protecting yourself against breast cancer, your first line of defense is a monthly breast self-exam.
Or you can do it whenever you
speaking,
want.
a breast self-exam
Within
doesn't
that
have
time
the potential
period.
to reduce the incidence or mortality rates of breast cancer, but it does allow women to become more aware of how their breasts naturally feel. This makes it more likely to notice an irregularity. While monthly self-breast exams can be effective in the discovery of surface abnormalities, your best defense against breast cancer is to get regular screenings.
I watch too much stuff.
It's recommended you discuss the different types of screenings with your physician to help determine which is right for you. Click on each one to learn more.
Oh my gosh.
A mammogram is a low-energy X-ray of the breast, and it's currently the most effective screening option for detecting the early stages of breast cancer. Most doctors recommend that all women 40 and older have a mammogram every year.
Right.
Those younger than 40 should discuss their personal and family health history to determine how often they should get mammograms.
That's where basically you crush, or like it basically squeezes your chest in between two X-ray plates and looks inside of the skin, I guess, whatever.
Most women have clinical breast exams done by their OB/GYN when they have their Pap test. It is recommended that women in their 20s and 30s have clinical breast exams performed every 3 years. Those 40 and older should have them done every year.
We're not the States, we don't have an OB.
And that's all I have for today.
Great.
Thanks for taking the time to learn more about breast cancer. See what else you can discover here
Thanks.
on surgerysquad.com.
I think I did I don't remember what I all did. Because when I did teeth, I was probably, that was the video that I did high on that stuff that they give you, but whatever. Hopefully Michael, I wish you would...
Welcome to Surgery Squad's virtual lumpectomy. I'm Dr. Susie, and I'll be assisting you with this procedure today. Breast cancer is a type of cancer that originates...
Okay. Is this one that I'm going to have to do both of the...
in the inner lining of the breast's milk ducts. And with the exception of skin cancer, it's the most common type of cancer in the United States. While we don't know what causes breast cancer, we do know that certain risk factors, such as age, genetics, personal health history, and diet, put people at a higher risk of developing the disease. Fortunately for our patient today, and the 200,000 women and men that are diagnosed with breast cancer each year, there are a number of treatment options available. This includes surgery, chemotherapy, radiation, hormonal treatments, and holistic medicine. Recently, our patient was diagnosed with stage 1 breast cancer after her doctor discovered a 2-centimeter tumor, or lump, within her right breast. Her doctor also determined that it is not spread into the lymph nodes in her underarms. If it had, we would need to reevaluate her treatment and breast cancer stage. One of the steps that we'll take today to eliminate our patient's breast cancer is a surgical procedure known as a lumpectomy. A lumpectomy is a brief, breast-preserving surgery that is used to remove... To begin the surgery, we need to start an IV to provide our patient with fluids and medication. I've already tied a tourniquet around her upper arm.
Great.
Can you find a suitable vein in the patient's hand?
This one.
That'll
again.
work. Sterilize the insertion area using an alcohol wipe.
Well, that's a little different. Can you... Alright, do it for me.
Insert the needle and advance the angiocatheter into the vein.
We have other stuff to do.
The small burst of blood that just appeared in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. Now I'll release the tourniquet. While some anesthesiologists may prefer to give a patient the size and location of a tumor is a deciding factor when the surgeon determines where to make the incision.
Yes.
Our patient's tumor is located
Right
just
there,
above the
great.
nipple of her right breast and about 2 centimeters from the surface. I
guess
think the best
medical
procedure to use in this case is what is known as a batwing mastopexy. Use the pin to outline the location of the tumor. Now sketch where we'll be making our incisions.
No. Why? No.
Perfect,
You're really gonna
but we're
make me
far
do
from
it.
done. Grab your scalpel and make the necessary incisions. This will allow us access into the breast to remove the tumor.
Great. Thanks.
Now remove the tumor and tissue from the breast using forceps.
Oh.
Great. I'll send this to our pathology lab for examination. In the meantime, why don't you go ahead and close the incision?
Don't make me do both of them. I'm just gonna, if you make me do both of them, I'm gonna actually physically skip the second one to the recovery.
Before we finish closing the incision, we need to irrigate the wound using a bulb drain. Drag the stylet and tubing through the incision to create a small puncture hole near the bottom of the breast. Great work! This tube will allow fluids to drain properly and aid in the healing process. Now we can finish closing the incision.
Wait, did my neighbors have company over during this time?
Excellent work. After the surgery, our patient will be moved to a recovery room within the hospital, where her heart rate, temperature, and blood pressure will be monitored by our wonderful healthcare team for the next few hours. Typically, a patient doesn't have to stay overnight unless they're having their lymph nodes removed in addition to the lumpectomy. When our patient returns home, she needs to ensure that she is following her doctor's recovery guidelines. These guidelines will include getting adequate rest, taking pain medication as directed, taking sponge baths until her sutures are removed, investing in a good sports bra that will help minimize any movement that may cause pain. After a lumpectomy, most patients will need to undergo 5 to 7 weeks of radiation therapy to ensure that the cancer is gone. The radiation therapy may also affect the patient's options for breast reconstruction. And that's a lumpectomy. I hope you've enjoyed playing and you've learned a bit about breast cancer and the lumpectomy procedure.
Anyway, okay, next. Did we do all these? I don't remember. Can we? Why? I don't actually think we need to do any more of these because I don't remember what we, I can't go back on the channel and look. I think we did not do eyes. I'm gonna do eyes next. I kind of don't want to do cosmetic because I think we did most of them. We did the tattoo, the hair transplant, we did the hair laser removal, and I don't know if we did rhinoplasty. I don't want to because I had my nose broken before. Okay, retinal. Oh gosh, this is gonna be so hard to do for me. Okay. Anyway. Okay.
Hello, and welcome to Surgery Squad's Retinal Detachment Surgery. I'm Dr. Jeff, and I'll be guiding you through this procedure today. The retina is located in the back of your eye. When we see, light enters the eye. It is focused onto the retina, which acts like the film in a camera, feeding information to the optic nerve, allowing you to see. As you get older, the vitreal fluid, which is the gel in your eye, can contract, pulling the retina away from the eye. This contraction can cause a small tear in the retina, allowing the fluid to seep behind the retina, detaching it from the back of the eye. This can cause loss of vision. A retinal detachment is a very serious ailment that must be dealt with as soon as possible after discovery. Symptoms that you may experience with a detached retina include seeing floaters or frequent flashes of light, shadows appearing in your peripheral or side vision, a gray curtain moving across your field of vision, or a sudden decrease in your vision. Again, if you experience any of these symptoms, contact your eye doctor immediately. Today, we're going to perform a retinal reattachment called a pneumatic retinopesky.
Oh my gosh.
The surgery takes about an hour and can be done on an outpatient basis. Our patient today is a 30-year-old man who recently noticed flashes in his vision. His ophthalmologist dilated the eye and detected a retinal tear and a detachment.
Well, you can
He
also
recommended
tell
immediate surgery to limit additional loss of vision. Let's begin.
It's a different color.
First, we need to administer a relaxing sedative. Now that the patient is
We've done that
anesthetized,
many
we insert a
times.
syringe into the eye. Now we inject an air bubble into the vitreal fluid. As the bubble expands, it pushes the retina back against the wall of the eye. With the retina back in place, we can now seal the tear using a freezing probe. The probe is touched to the outside of the eye where the tear is. This freezes the tear back in place. It may take several touches depending on the size of the tear.
Oh my
The tear
God.
is now repaired. The needle insertion will heal quickly. Can you remove the speculum?
You can't do that? All I have to do
Our
is click.
patient needs someone to drive him home after the surgery, and he shouldn't drive until he regains sight in the eye. We will prescribe medicated eye drops to use several times each day for a few weeks after the surgery, and he'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses also need to be worn to protect his eye from sunlight and other bright light as his eye recovers. However, the biggest part of the recovery is head positioning. The bubble floats to the top of the eye, so the head must be positioned to keep the bubble against the detached portion of the eye. This means the patient must keep his head facing down, or the position indicated by his surgeon, for at least a week. Sight returns slowly to the eye over several months as the bubble must dissolve and be replaced by vitreal fluid. However, once the bubble dissolves, vision is usually restored to close to the previous level.
So
You did a great job today, surgeon. While you're here, try one of our
No,
other surgeries
stop.
here at Surgery.
So you legitimately have to do everything with your head down. That was quick. I thought it was going to be long by the look of it, but every section was short.
Hello, and welcome to Surgery Squad's Cataract Surgery. I'm Dr. Susie, and I'll be guiding you through this procedure today. A cataract is a clouding of the lens inside the eye. The lens is located behind the pupil and focuses light on the retina. A cataract causes loss of vision that can't be corrected with glasses, contact lenses, or even LASIK, so it must be surgically removed. We're going to remove the clouded lens and replace it with a new one called an intraocular lens, or IOL. The surgery takes about an hour and can be done on an outpatient basis.
That's why it's so long.
Today, our patient is a 66-year-old woman who has noticed an increased blurriness in her vision, as well as decreased night vision. She saw her eye professional, and she detected cataracts and recommended her to us for surgery.
First of all, we can't see very well at night anyway.
First, we need to administer a relaxing sedative intravenously. We begin the surgery with a small, painless initial side port incision. This is called a limbo corneal incision.
8 carats, number 1, and
It's
number
done
2,
by making a small cut in the
we
limbus
definitely
with a
do not
crescent
be
knife.
able to see properly at night anyway.
Next,
Not
we use
cats.
the crescent knife to make a corneal tunnel into the interior chamber of the eye.
Oh, I hate this. Oh, no.
A thick, transparent viscoelastic
No.
fluid is injected to fill the space between the cataract and the delicate underside of the clear cornea in front of it. This is done to keep the cornea from collapsing during the procedure. Help me out and inject the fluid into our patient. Now we need to make a 2.85 millimeter wide incision at the edge of the cornea for the cataract removal. This is done with an extremely thin diamond scalpel.
No. No.
A bent needle is inserted into the incision and used to poke a hole into the clear sac that holds the lens with the cataract.
No,
The needle is dragged to cut a line in the sac. With the incision made, we'll insert the forceps to grab the torn sac and tear a circle out of it.
No. I'm not doing that, by the way.
Now you will need to inject fluid into the incision to separate the lens from the capsule. This causes the lens capsule to float so that it can be rotated during the next step. We'll now perform phacoemulsification, or phaco. This is done by using ultrasound to break up the affected lens so it can be removed from the eye. To do this, we pulse and drag the device to cut across the cataracted lens.
Oh!
We repeat the phaco from the other direction to create 4 pieces. The phaco is then used to suction out the pieces of the old lens.
That's a glitch.
I'll need you to remove the last remaining soft cataract material out of the eye, leaving behind the clear, empty lens capsule.
Oh my goodness. we have...
When you're
I
done,
might just...
inject more viscoelastic fluid into the lens capsule to keep it from collapsing.
Was this the last one? Or was this still the first one? I don't know.
The flexible intraocular lens is rolled up for insertion by the assistant and placed in a soft tube. The IOL is now injected through a tube into the vacant lens capsule. A probe is used to spin the lens into place. The thick fluid we added to the eye will need to be removed, and any remaining microscopic cataract fragments should be rinsed out as well. The incisions in the eye are generally self-sealing. Very rarely that we need to add a suture to close the incision. In our patient's case, we don't need any sutures. The lens is now in place. Our patient will need someone to drive her home after cataract surgery, and she shouldn't drive until she's cleared at her follow-up appointment tomorrow. We'll prescribe medicated eye drops to use several times each day for a few weeks after cataract surgery. And she'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses will also need to be worn to protect her. You did a great job today, surgeon. While you're here...
Thanks. Okay, last one. LASIK. Oh my goodness. Last one today, actually. I'm gonna do the rest tomorrow, probably. Because this almost...
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes? Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide.
This is the longest
So let's
one.
get that speculum. If the patient was allowed to blink, we might cut or burn the wrong area. At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye. The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring.
I'd rather just
We
use
slide it
contacts
across
for the
and it
rest of
cuts
my
the
life.
top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
So cringy.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap. This is the part we'll reshape with a laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair.
Great.
And that's it. Please fold the corneal flap back into the original position. Nicely done. While you were working, I went ahead and took care of the other eye.
Thank you.
We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two.
We know this.
She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery.
Great.
You can see more of my superior surgical technique in
Sure. Okay. Well. Anyway, so we have gastric, Orbigene. I don't know what I've done already. Probably nail, which is only one. Oral. I don't know. I think I did this all when already. And then orthopedic. Carpal tunnel. So we have, okay, I'm not going to do cosmetic anymore. I'm done with that. So this one, this one, this one, and this one. As far as I know, I don't know what's all done already. Michael hasn't uploaded any of the videos as I'm recording this. But as soon as you see this, videos are going up on the channel again. So I don't know what I did and did not do, and I don't have a copy of the videos myself anymore. Not that I want to go look for them because I haven't. I just send them what what it is. It'll go straight, like the title will be the date and the time recorded, not anything, not any special titles that I pick. So, and I just send him it like that, and then he ends up titling them because I don't know how he ends up editing them. So it's just all called raw footage. So I don't think, well, okay, cosmetic. I don't know. I think we did tattoo removal, hair transplant, and laser or laser hair removal. I don't think we did any of these other ones, like liposuction. I don't think we did. Rhinoplasty. I don't know. Saline. Chest implants, silicone chest implants, and Botox. I don't think we did. We just did all that one. We did oral. I don't know. I'm pretty sure we did more, but I'm not gonna be able to ever find it until they're uploaded. So I should make a mental note for tomorrow to get this all done, but like some of these are very long. So technically we still have cosmetic, gastric, OB, gene, nail, and ortho. I think that's all we have. And ortho is just literally carpal tunnel. So this one has one, this one has one, this one has 3. Child birth, right? And this one has 4. Because I don't know if I did anything with this one. I don't remember. If I did, whatever. And then the rest of cosmetic, like I say, I think we did only these 3 here. So, and I'm going to do the rest another day because like I say, I only have like, I think 3-4 more days to do these. And yeah, so anyway, thank you guys. Thank you guys so much for watching these videos. I don't know how Michael is. Michael might just take this outro and the intro and change things up. So anyway, thank you guys so much for watching, and we'll see you guys in the next one. Bye bye.